Hello, I am Sister Saroja, Deputy Nursing Superintendent and Infection Control in Premier Hospital. Good evening to you all. Thank you for joining us today in the Premier Hospital auditorium. We are having completely sophisticated facilities to take care of all kinds of diseases in a multi-speciality environment. Today I am sitting with these experts, leaders to understand the public health implications of COVID-19 virus, which has become a greatest pandemic recently seen by our present generation. We have reached a new level of destruction in the life of humankind throughout our country and the entire globe due to COVID-19. Empty market crowds, closure of educational institutions and social gatherings, shutdown of public transport and lockdown at home and social distancing has become a daily norm implemented by our government. Right now, the entire globe is focused on finding a vaccine to cure COVID-19 virus. But as time passes, we need to consider the economic, social and psychological effects on human race. We have a lot of true information on COVID-19, but sad to say, a much more wrong information floating around by social and other media channels. Today, we would like to provide you the accurate information right now available with us about the virus and the issues related to the crisis. We hope to give you our thoughts and expert opinions about present crisis recent to COVID-19. Now let me introduce our panels of esteemed colleagues and experts from various departments of our hospital. First, let me turn to Sister Dhanlakshmi, who will brief us about infectious diseases. She is having experience in Department of Infection Control. Sister Dhanlakshmi, welcome to the discussion. You being an experienced person in the field, can you tell us how to respond to this pandemic and how things are going on around the globe?
Thank you, Sister Saroja, and good evening, everyone among us who is sitting here. And it's my honor, and I'm very much happy to be a part of in this COVID-19 panel discussion. First and foremost thing is, I would like to discuss few points being worked as an infection control nurse. We should give awareness to the public how to respond in a troubleshooted pandemic situation when they affects badly. And our primary goal is to minimize the community spread of virus and try to prevent the severity of the situation. Therefore, many different principles to deal with the different viruses. And this COVID-19 virus is new virus from the family of which we already had gone through and dealt with something called as SARS and MERS in the past. Every human knows that very well what is happening in the world across the globe, including our India that is impacted by COVID-19. To add on, to contradict the outbreak, how can we stop the transmission? First thing is, predict the virus among the public, follow strict isolation alongside follow-up of contacts. To identify the virus in a patient, go for checking of physical signs and symptoms and testing after taking off nasal and throat swabs from the patient. Also, WHO recommends the same. There are some more efficient measures to tackle the situation. Can be quarantine, strict self-isolation and follow-up of contacts. To sum up, to minimize the consequences, should have social distancing, shut down the schools, malls, movie theaters and withhold for family and social events, avoid group gathering, crowded areas and employees can have startup of work from home. Moreover, as per the WHO evergreen guidelines, we can take as protective measures against the COVID-19, frequent hand wash with soap and water, thorough use of sanitizers, avoid touching of your face, mouth, and nose, eyes. Also try to cover your mouth and nose with your bent elbows when you cough and sneeze in the public areas. Always try to cover your nose and mouth with 3-layer face mask when you walk away from the home. Perhaps it is really unsustainable crisis to face for general public, but these simple precautions can help a lot to slow down the community spread of coronavirus. Thank you.
Sister Dhanlakshmi, thank you very much for the information. Now, I turn to our next guest, Sister Rani. She is having an experience in testing different kinds of viruses. Right now, she is an expert in testing the COVID-19 virus as well the other viruses in our hospitals. Sister Rani, kindly tell us about how testing is done.
Thank you, Sister Saroja, in this opportunity. Good evening, and all. And I need indeed in consider this is an honor to be this panel of discussion along with experts in treating COVID-19. First of all, we need to understand who should get tested for novel coronavirus. If you are close contact of someone with COVID-19 or you are a resident in area where there is ongoing spread of COVID-19 and has developed COVID-19 symptoms like fever, having difficulty in breathing, severe flu and cold. In India, call COVID-19 helpline 104 or immediately visit nearby clinic or inform your doctors and tell them about your symptoms and exposure. They will decide whether you need to be tested or not. Keep in mind that right now there is no vaccination available for COVID-19 and people who are middle and well may be able to isolate and take care for themselves at home. Test will be primarily for hospitalized or severe infected patients. People of all ages can be infected by coronavirus. Older people with over 60 years and individuals with cardiovascular diseases, diabetes, chronic respiratory diseases and cancer are not much higher risk in getting the COVID-19 virus and such are most priority for testing. At present, there are very less kits available in India for testing COVID-19. So self-isolation is the best option. Now coming back to point of how testing is done. Testing for COVID-19 involves inserting 6-inch long swab in the cavity between nose and mouth for 15 seconds and rotating the swab several times. The swabbing is repeated on other side of the nose and make sure enough material is collected. The swab is then inserted into container and sent to lab for the testing, which gives the result. Thank you, sister.
Thank you very much, Sister Rani, for the information given to us on testing. For the further information, most of the people who tests are found to be positive are getting recovered because their immune system is stronger. Right now, there are only few death cases in India. Now, we are very much fortunate to have Sister Adira in our midst, who is an expert in immunology. Sister Adira, you are working to understand how our immune system is dealing with the COVID-19 virus. Kindly tell us how it works.
Good evening to all. Thank you very much, Sister Saroja. This is a new virus and we are learning how it infects our body and how our body responds to it. The immune system is the body's multi-level defense network against potentially harmful bacteria, viruses and other organisms. Previously, as you correctly said that most of the people recover from the virus without a problem because our immune system is actively attacking the virus. Now understanding how our immune system does, that is a critical part for us to work out. How we can manipulate the immune system through the production of immune system is actively attacking the virus.
It's okay.
It's okay, you carry on.
Now understanding how our immune system does, that is a critical part for us to work out. How we can manipulate the immune system through the production of vaccines. Right now, this is a major challenge to immunologists around the globe. There are many laboratories are working on vaccines across the globe and some are at very close stages in finding the vaccines. As my colleague Sister Rani's explanations, so far there is no vaccines available to treat coronavirus. The only option is to keep our immune system in the best healthy condition to tackle any kind of viruses. Now the question arises how to keep our immune system in good health. A healthy lifestyle, not smoking, drinking little or no alcohol, sleeping well, eating a balanced diet, doing regular moderate exercise and reducing stress. By this we can keep our immune system in good health.
Thank you very much, Sister Adira, for the information given to us on immune system. As you and Sister Rani said, right now there is no vaccine available to treat the COVID-19 patients. Now the only option available to us is by keeping our immune system in good health and maintaining healthy lifestyle. Now we have a Sister Pearl Sofito with us who has done enormous research and analysis on COVID-19 cases in India and abroad. She has enormous current data available with her right now. Sister Pearl, welcome to our show and kindly brief us what kind of research and analysis you did on COVID-19 and explain us data available right now with respect to COVID-19.
Thank you, Sister Saroja. Thank you very much for inviting me to this discussion, and it is my privilege to be with honorable dignitaries at this evening on discussion on COVID-19. The coronavirus COVID-19 is affecting 212 countries and territories around the world. Wuhan, the city where the virus originated, is the largest city in central China with a population of over 11 million people. The city on January 23 shut down transport links. India's first case was reported on January 30th in Kerala. Maharashtra is now the worst affected state with most number of confirmed COVID-19 cases. As per statistics released by the World Health Organization, there are 33,27,424 cases across the world. 2,34,730 deaths, and right now 10,52,630 people recovered. Coming back to India, as per statistics released by World Health Organization, there are 35,043 confirmed cases, 8,889 recovered, and 1,147 deaths. The western state of Maharashtra reported the highest number of coronavirus COVID-19 cases as of May 1st, 2020. With 10,498 cases. The western state of Gujarat and the capital city of Delhi trailed behind. As of that day, there were a total of 35,043 confirmed infections across India. The country went into lockdown on March 25th, making it the largest lockdown in the world, restricting 1.3 billion people. As per today's state-wise data available with us, most affected state is Maharashtra with 10,498 cases and 459 deaths. Telangana stands in 9th place with 1,038 cases recovered 397 and 26 deaths. Our neighboring state, Andhra Pradesh, stands on 8th place with 1,403 cases, recovered 321 and 31 deaths.
Thank you very much, Sister Pearl, for the information given to us on current data on COVID-19. Really, it's an amazing data on COVID-19. Now we have a Sister Farusha with us who had done research on economic, social and psychological effects on human race due to COVID-19. Sister Farusha, welcome to the discussion on COVID-19. We know you have a vast understanding of economic, social and psychological effects on humans due to COVID-19. Now it's your time to explain us.
Thank you, Sister Saroja. It's an honor for me to gathered here for this panel discussion of COVID-19. I heard experts' discussion regarding various things on COVID-19. I'm really honored to take part in this discussion. Government of India is taking all necessary steps to ensure that we prepared well to face the challenge and threat posed by the growing pandemic of COVID-19, the coronavirus. With active support of the people of India, we have been able to control the spread of virus in our country. The most important factor in preventing the spread of virus locally is to empower the citizens with the right information and taking precautions as per the advisories being issued by the Ministry of Health and Family Welfare. In India, up to 53% of business establishments suffered shutdowns caused by COVID-19. Various businesses such as hotels and airlines are cutting salaries and laying off employees. Around 400 million workers employed in the informal economy are at risk of falling deeper into poverty during this crisis. More than 45% households across the nation have reported an income drop as compared to the previous year. On 4th April, former Reserve Bank of India Chief Raghuram Rajan said the coronavirus pandemic in India may just be the greatest emergency since independence. It impacted all kinds of industries economically. Coming back to social and psychological effect, enforced isolation, social rejection and financial crisis can contribute to depression in human beings. Quarantine can cause negative psychological impacts, including post-traumatic stress symptoms, confusion, anger and depression. Many people feel distressed at the prospect of being quarantined. Enforced isolation in a quarantine environment, often in a strange places, social rejection by people who are afraid of dealing with the cured or suspected patients, and unexpected financial crisis are just some of the other contributing factors for depression and suicidal thinking in the quarantined people.
Thank you very much, Sister Farusha, for the information given to us on economic, social and psychological effects on humans due to COVID-19. Now, with this I am going to conclude the discussion on COVID-19. I don't want to stretch it more as the time is running out short. Thank you very much once again for listening patiently, and I hope for our expert panel has given perfect understanding reading regarding COVID-19. We wish you all a safe and happy life and happy Nurses Day.
Thank you.